parasympathetic nervous system. So if you stimulate in that area, in that region, you activate the vagus nerve and also glossopharyngeal nerve and the facial nerve. So the parasympathetic activity increases more. This is the advantage. This was our first ear sets stimulating from the tragus and concha regions. We position the electrodes as much as possible away, because when you increase the distance between the electrodes, the stimulation area increases. So here one of the electrodes touches to the tragus and the other concha, so you increase a huge area. So the fibers cannot escape from the stimulation, in that stimulation. But because of the metallic uncomfortness, we can say, because the pressure is high between the skin and the electrode because of the metals, we changed newly the electrode types. Now this is the carbon silicon type, and I bring with me, and after the presentation, if you want, we can make demos stimulation. You will see the electrodes. So we changed the type carbon silicon. So without gel also, you can use with water for the stimulation, and it's more elastic, so it doesn't cause too much pressure. So very easy use. There are also objections. So I am telling not every time the good things. Also there are bad things about the vagus nerve stimulation for the different methods. For example, for the auricular branch, some of the authors or researchers say that the auricular branch is a very small branch. So you cannot increase the parasympathetic activity with ear stimulation, they are saying. And also ear stimulation is not specific due to the large number of different nerves and anatomical variations. Little evidence exists that stimulation reaches the vagus nucleus. But we always measure the activities of the vagus nerve in our studies, research. So heart rate variability, did you hear before? Heart rate variability, it shows the variations in the heartbeats. It shows the sympathetic and parasympathetic activities. So before the vagus nerve stimulation, we measure sympathetic and parasympathetic activity, and after the stimulation, we again measure. So we see that really, or it is really increased or not. The elevation is significant or not, we can see. So this is not so valid, we can say, because we can increase the parasympathetic activity. Yeah, non-specific, it's true, ear stimulation, because we don't know the stimulation going to where for each person or patient. We stimulated the vagus nerve, but we don't know the liver is activated or not, the lungs are activated or not, the intestines are activated or not, we don't know. We activate something, yeah, parasympathetic activity increased, but in which organ we are seeing the effects, in which part of the brain we are seeing the effect. So, for solving this, what can be done for precise stimulation? What can be done in the methods? If you can make customization or personalization for the stimulation parameters for each patient, then you can do it better. So we added AI algorithm for that machine learning system. So for example, you have a stress problem or you have an insomnia problem. So you start with the suitable parameters. The AI offers you the most suitable parameter according to your age, your body mass index, for example, your gender, because we inserted more than 600 studies into the AI system, machine learning system. So according to the 600 studies, we know that for the women, this frequency is better, for the man, this frequency is better. So we are subclassifying all the situations, and the AI offers you a parameter for beginning. After 1 week, according to questionnaires or your heart rate variability, so again AI is on the action and saying that are you okay or not? Your problem is going on, or it's less now, or it's high now. According to that, A plan is left, and it starts with the B plan. After 1 week later, if the AI or if your status needs another parameter, so C plan, D plan, so lots of variations can be done according to your status. So customization is the solution for that. Ear stimulation is not specific, but with customization you can do it specifically. And little evidence exists that stimulation reaches the vagal nucleus. Yeah, because the nuclei is very small, so it is very hard to prove it, but animal studies show that ear stimulation goes to the vagal nuclei. It can be said that right or left auricular vagus nerve stimulation is equally effective and safe in cardiac autonomic dysfunction. So this study investigated the research. It's a review article, letter to the editor, but they say that the authors say that left and right sides vagus nerve stimulation is effective and safe. So what is like that? In the neck region, it is not like that, but in the ears, right or left side, they are equally safe, we can say. So what is the difference? In the ears, there are no afferent fibers, so the stimulus doesn't go to the organs directly. The stimulus goes to the brain firstly. After making synapses, synaptic connections, the stimulus goes to the organs. So brain is a filter now. Okay, when you stimulate from the ear, you cannot affect the organs directly. So brain makes a filter in the brainstem, so it is safe and effective for the right and left side. But it's not true for the neck, because we are actually asymmetric organisms. Our right part and left part are not symmetrical. For example, liver is on the right side and the spleen is on the left side, for example. The fibers going to the spleen and the liver are different for the vagus nerve. But in the ear, right and left part all goes to the brainstem, so they are equally safe and effective. Also, there are numerous sympathetic fibers around the cervical vagus nerve, so cervical vagus nerve stimulation can cause undesirable effects via afferent fibers, also for parasympathetic and also for sympathetic. Auricular vagus nerve stimulation can be considered a cost-effective and non-invasive method for cardiovascular diseases. Why they always say cardiovascular problems? Because they firstly thought that actually our first ethic committee approval was long, about 6 months. Getting the approval, first approval lasted 6 months, because the professors in the ethic committee said that if you stimulate your vagus nerve, you can stop the heart. We said that we are stimulating from the ear, not from the neck region. There are also invasive stimulation from the neck, so we are doing it non-invasively from the ears, but they didn't believe us. But after 6 months, we got succeed and get the first ethic committee approval and made our first study. So most of the scientists focus on the cardiovascular effects of the vagus nerve stimulation. But all the studies up to now showed that auricular vagus nerve stimulation is effective and safe for the cardiovascular problems. So what about the non-invasive cervical vagus nerve stimulation? There are devices making stimulation from the neck, but you cannot touch directly to the vagus nerve because it's not superficial. So if you increase the stimulation intensity or other parameters to reach the vagus nerve, then near the vagus nerve there are also sympathetic fibers. So how can you know that this stimulation is only stimulating the vagus nerve and not stimulating the sympathetic fibers? So it's very difficult. And also, if you make a pressure on your neck here like that, so what happens?
The bottom receptors.
Yeah, yeah.
Is
So,
that a contraindication for electrotherapy? You're not supposed to put electrodes there.
Yeah.
In TNS.
So if you make a pressure like that, you can also decrease the sympathetic activity because of the receptors in that region. related with the body blood pressure and also the chemical receptors for the oxygen located in that region. So when you stimulate by pressure, you can also decrease the activity of the sympathetic nervous system. So there is not any study differentiating the pressure effects and the stimulation effects up to now. So these are the problematic parts for the cervical vagus nerve stimulation. You can stimulate both afferent and efferent fibers. So if you want to increase the effectiveness, then because of the stimulation of the afferent fibers, then you can cause side effects. When you decrease the stimulation because of the side effects, then the effectiveness also decreases. So again, that's a problem. You cannot do simultaneously left and right stimulation because you can decrease blood pressure and heart rate. So it's again limits the effectiveness. Yeah, again the same problem. There is the evidence that non-invasive stimulation reaches the vagal nucleus in the brain. So other VNS techniques, vagus nerve stimulation techniques, we didn't talk mindfulness, but we talked deep breathing, and also mindfulness meditation can be done for increasing the vagus nerve activity. Biofeedback can be done. Muscle relaxation techniques, cold water contact, carotid sinus massage for the pressure in the neck, carotid sinus massage. So they all can be done, but here again in the picture you can see that hypnosis, meditation, tai chi, yoga, they can increase the vagus nerve activity, and also nutritionally you can increase your vagus nerve. And cholecystokinin, you know the hormone cholecystokinin, it causes contraction in the gallbladder. If you eat fatty foods, then vagus nerve is activated, but not all fatty foods. The perfect one is the Mediterranean diet. It exists. Also in fish oil, there are unsaturated fatty acids. So, for example, your fish in the cold water, because they carry unsaturated fatty acids, it increases the vagus nerve activity. Fish oil, and the other, which oil? Plant oil in Mediterranean region. Olive oil. So olive oil is important because it carries unsaturated fatty acids, so it causes cholecystokinin hormone elevation, and cholecystokinin hormone also increase the vagus nerve activity. Also, you can use drugs, pharmacological activation can be done, or nicotinic agonists, because nicotine also increases the activity of the vagus nerve, and eventually they cause anti-inflammation in the body. So, advantages of the electrical stimulation. Due to the diversity of parameters used in many different diseases and very different effects on the brain and organs, we talked this. For example, in traumatic brain injury patients, in septic conditions, in sepsis, in stroke, in Parkinson, Alzheimer's disease, or neonatal opioid addiction. For example, the newborn baby cannot do deep breathing, so it's a problem. Or the stroke patients maybe cannot do meditation because of the stroke. Or in inflammatory bowel disease, Crohn's disease, ulcerative colitis, you can decrease the inflammation more with the electrical stimulation of the vagus nerve. So it's a passive stimulation actually. The patient opens the device and starts the stimulation. Very easy. No need so much time for learning. For example, for meditation, you should do lots of practice. You should need lots of practice for the correct meditation. But for the correct vagus nerve stimulation, it's very easy. You can start immediately. So what about the side effects? In auricular stimulation, half of the studies reported no side effects. The most common were ear pain, tingling in the ear, itching, and redness. Most of these problems are related with the electrodes, because of the metallic electrodes. So because of we see these side effects, we changed our electrode type. And in the cervical stimulation, nasopharyngitis, skin irritation can be seen. In both headache, dizziness, lightheadedness, and nausea can be seen. Because when you stimulate your vagus nerve, Emptiness. Most of the patients say that I feel emptiness, lightheadedness. I drink too much alcohol, they say. So it is the cheapest way, maybe, according to the alcohol drinking. So some of the patients complain about these side effects. What about the contraindications? For example, if the patient has hypersomnia, always sleeping, can we stimulate the vagus nerve? Hypersomnia, the patient has, always sleeping, and come to you, I have a back pain, and I'm also sleeping too much. Help me. The patient said. It can be applied or not.
Is it always increasing the activity in vagus, or is it more balancing?
Yeah, true approach. I can say.
So you can
That's
adjust
the
if you
logic.
wanted to elevate or decrease.
Yeah, that's the logic. So, with high frequencies, actually, high frequency electric stimulation stops or not totally, I can say, or permanently, maybe true. If you stimulate high frequency electric, if you apply high frequency electrical stimulation, you can decrease the activity of the nerve. This stimulation starts in which frequencies, do you know? In which frequency, if I apply blah 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 frequency to a nerve, I can stop the working of the nerve. I can stop the stimulus propagation in the nerve. In which frequency? Mr. Rick?
I don't know. You tell me.
After 10,000 frequencies, hertz, immediately you can block the nerve after 10,000. In some research, it is said that 15,000 frequency hertz at least you should apply to block the nerve immediately. Below 10,000 or below 8,000, it depends on the nerve fiber, the diameter of the nerve fiber, and the myelin sheets covering the nerve fiber. It changes. So this is the detail, not related to this presentation, but for general information I can say. So you can block the nerve transmission if you stimulate with high frequencies. So in hypersomnia, it is relatively contraindicated. You can increase the sleepiness of the patient, but you can also regulate it. We don't know. So it is a bit problematic in hypersomnia. In diarrhea also, because vagus nerve causes defecation, it works the intestine. So if you stimulate vagus nerve, you can heal constipation of the patients. Okay, but if the patient has diarrhea, then you can interrupt the stimulation sessions, wait for the diarrhea passing, healing, and then after that, again you can apply vagus nerve stimulation, or you can do it with small durations and see if it is increasing or not, diarrhea increasing or not. So these are the relative contraindications for the vagus nerve stimulation. Also in hypotonicity, vagus nerve decrease the tonicity or tonus or tone of the muscle. In stressful conditions, for example, I contract my chin muscles like that when I am get angry and why I am stressed, for example. Also in bruxism, all the studies show that in stressful conditions, the sleep bruxism happens in the night during sleeping. Okay, because in stressful conditions we increase our muscle contractions. Why? What is the reason? Because muscle contraction is needed for fighting or for flighting. So in stressful conditions, unconsciously we increase our signals to the muscles, so muscle contraction increases. So in hypotonicity, especially in newborn babies or in congenital problems, we can see hypotonicity in the babies. So if you apply vagus nerve, there is a probability for decreasing the muscle tone. So It is again relatively contraindicated. We don't know. There are no studies about that. I am asking the questions to you and also to the neuroscientist for that. So this book also deals with these problems. Actually, can be applied in obesity, for example. Can be applied in pregnancy. Can be applied vagus nerve stimulation. It can cause teratogenic effects in the baby or not. What do you think? We don't know, but it is more safer according to drugs. So, if the pregnant woman needs drug usage, before drug usage, it can be tried. But there is no study in pregnancy up to now. So, in pregnancy, we cannot use the vagus nerve stimulation because we don't know the effects of it. In gastritis, can we use the vagus nerve stimulation? This is different from these three problems. In gastritis. So the vagus nerve increase the stomach acidity.
Well, maybe we can use it because you can get gastritis because of the stress.
Yes.
And you can increase what do you call it in English? Lungs.
Inflammation.
Inflammation,
Yeah, here you can see IT, so IT means inflammation in the stomach for this word, gastritis. So again, it may be stress related. So you can decrease the effects of the gastritis if you stimulate the vagus nerve. But vagus nerve also increases the stomach acidity, but also it decreases the inflammation. So here it can be helpful or not. So it changes from person to person. Okay, you should customize the treatment for your patients. In gastritis, in vertigo or dizziness, you can apply or not. Again, it depends on the patient. We have finished a study for the benign paroxysmal positional vertigo, and the patients get benefits from the vagus nerve stimulation. Their vertigo decreased. But in some people, it may increase, we don't know. So again, in vertigo and dizziness, it may be problematic. Sleep apnea, it can be used or not. Vagus nerve stimulation. It increases the sleep quality, deep sleep. It increases deep sleep.
And
So-
also reduces the muscle tone,
Yes.
and then it should be couldn't increase the problem.
Yeah, increase the problem. Yeah. In sleep apnea, it may increase the problem because it decreases the muscle tone, and also it causes deep sleep in the patients. So apnea may increase because in apnea condition, the patient must awake for getting more oxygen. So the awakening is done by the sympathetic nervous system. The patient's oxygen level decreases. The patient's sympathetic nervous system gets alerted because of less oxygen. So it wakens up the patient in sleep apnea. So if you stimulate the vagus nerve, then he or she cannot awaken, then apnea may increase. So these again relative contraindication in asthma or dyspnea can be applied because vagus nerve decreases the bronchi, the diameter of the bronchi, and decreases the lung capacity. So in asthmatic conditions, emergency conditions in asthma, sympathetic drugs, soluble sympathetic drugs are given, inhalers. They contain adrenergic drugs for increasing the respiratory tract diameter. So when you stimulate vagus nerve, you can decrease the diameter of the respiratory tract. So can we apply or not? So there are studies about that. So we are sure that ear stimulation is effective and can be used in asthmatic patients because the effectiveness related to decreasing inflammation is bigger than the decreasing the diameter of the respiratory tract. So it is proved in research that it's effective because decreasing inflammation is more potent according to decreasing the diameter. But in cervical stimulation, it is questionable because you also stimulate afferent fibers here, so you can cause bronchoconstriction, but it has also anti-inflammatory properties. But cervical stimulation is relatively contraindicated. Ear stimulation is safe and can be applied to the patients. So when we look at the etiology of the problems, we can see we talk about the stress and also we talk about the gut-brain axis. Here, for example, this is taken from a good study, a new study, nearly new study we can say, 2020, the dates, year of the study. So if you have disturbed gut-brain axis, you are supposed to get psychiatric disorders, pain, neurodegenerative disorders, obesity, addiction, epilepsy, stroke, irritable bowel syndrome, and anxiety, lots of problems. So the vagus nerve has been shown in some studies that can contact with the mucosa in the intestine. So there are neuropod cells here in the intestine, and they are sensing the chemicals inside the lumen of the intestine, and they send the signals via the vagus nerve to the brain. So Parkinson's disease nowadays are completely, maybe we can say, maybe not completely but nearly completely, is related with the dysbiotic microbiota in the intestine. So vagus nerve, it's said that it's a guilty, the vagus nerve, because it transmits the signals, dysbiotic microbiota signals from the intestine to the brain. So when you cut the vagus nerve, you can stop the progression of the Parkinson in animal studies if you cut it, because it transmits the signals. But if you can regulate the vagus nerve and if you can change the activity, then you can resist the problems carried from the intestine to the brain. We did a study with our device in Parkinson's disease patients, and we measured the tremor level. When we apply vagus nerve stimulation, the tremor decreased in Parkinson's disease patients because it decreases the muscle tonicity. So when the muscle tonicity decreases, the tremor severeness decreases, symptom level decreases. And also, we made a study with our V1 version device in the rats, and seeing the effectiveness in the gastrointestinal system inflammation. Here, the scientist inserted TNBS. It's a toxic agent and causing inflammation in the intestine. So from the rectum or anal region, it was inserted to the intestine. And here you can see in group 3 the inflammatory problem in the intestine, inflammation obviously seen. And in group 4, again the toxic agent injected and vagus nerve stimulation applied. So macroscopically, you can see that there is a big difference between them. And also histological investigation showed that nearly the damage score is half of the group 3 in group 4. Yeah, group 4. According to group 3, the damage score is nearly half of it. And for the inflammatory markers, again nearly half of in the blood samples. Here you can see the inflammatory markers are low, and they are statistically significant that vagus nerve stimulation can decrease inflammation in the intestines. And the researchers applied 10 days of stimulation with 10 minutes daily. So it is not so high for daily usage or for the sessions. It is not so long. With 10 days, with 10 minutes stimulation, you can decrease the inflammation. Maybe if you prolong this duration and if you increase the stimulation duration, maybe it will be more effective. We don't know, but it shows that this is effective. So stress can cause lots of problems in the body. For example, stress-induced eating. In 40% of the society, in stressful conditions, 40% of the people stops eating. Stress-induced anorexia. For example, let's make a calculation here. In stressful conditions, who stops eating? I, for example, stop eating. Anyone? No? Yeah. In stressful conditions, I eat too much. Who can say that? So the percentage is not similar with the normal society, and 20% of the people say that my eating habit does not affect it from the stress. 20%. 40% eats too much. 40% stops eating. Why? Why it's like that? Why first 40% of the people increase their eating in stressful condition like you, and why the others stop eating? For example, I stop eating because in stressful conditions, if my stomach is full, I can't run easily or I can fight. I can do exercise, for example, with my stomach full. So unconsciously, my brain always think that if there is a huge stress, stops eating because you cannot fight or flight easily. So for the eating sides, why do you eat? Lots of fingers I see. Why do you eat? So you think that if you eat, then your your stomach is stretched. We talk this. So your vagus nerve activity increases. So you want to stop the stress effects on your body by eating, increasing the parasympathetic activity or increasing the vagus nerve activity. You want to resist the stress effects. So I think that I cannot fight or flight because of the stress, so I stop eating. So you think that there is too much stress, my sympathetic activity is high, so I should stop it. So how can I stop it? So eating and vagus nerve is activated. So you think that, yeah, I stop my stress level. But in chronic conditions, you got obese, and again vicious cycle starts. So vagus nerve stimulation can increase gain weight in anorexic people. There are studies about that. In anorexia nervosa and bulimia nervosa, vagus nerve stimulation increases gain weight or weight gain in these patients. And also in obese patients, vagus nerve stimulation causes weight loss. So the same treatment, different patient groups, but causes different effects. In skinny people or slim people, it causes weight gain, and in obese people, it causes weight loss. So this is the problematic part of the autonomic nervous system or vagus nerve. So the scientists cannot solve this problem up to now. I'm not saying that I am the only man to solve this problem. So there are huge parts that we need to know, investigate. So we are investigating again and again. So continuing for the investigation of the vagus nerve, but it is too much problematic to understand it. Yes, we can skip. So also stress is different. Good stress is called eustress and can improve performance and mood. If you can control your stress, it is not harmful. If stress controls you, then it's harmful. So you don't need to delete all the stress because it maybe causes motivation. It can increase performance. For example, you have an examination tomorrow and you say that no problem, I don't need to work, for example, no stress, then no motivation, so you can get failed. But if too much stress, then your brain cannot work properly. Again, you cannot be successful in the examination. So we are aiming to control the bad stress, not the good stress actually, by vagus nerve stimulation. So acute stress can affect the brain in a positive way. In acute conditions, the brain can be affected positively. But if the chronicity starts, the stress causes negative effects on the brain and the organs. So by time, the stress can cause autoimmune infections, autoimmune problems, allergic diseases, or longer infections, cancer, cardiovascular problems, obesity, metabolic diseases. So I finished the first presentation. Any question I can answer? Thank you for listening. Yes.
It was about fight response that you had the relative contradiction.
Yes.
And the state when the traumatic situation when people getting like more the hypertonic state, like pain that
Yes.
when the nervous system is like more or less dissociative.
Yeah, vasovagal syncope, for example.
Yeah, so everything is just shut down.
Yeah.
For those kind of patients that has that kind of reaction for with overwhelmed
Yeah.
traumatic response, is it what do you think about because it's a stress situation, but it's everything is just like
Yeah, in vasovagal syncope, there is a history like that. So you must be cautious about the vagus nerve stimulation. So you can start with shorter durations to see any side effect happening on the patient or not in vasovagal syncope or the other conditions. You can use it, but let's come to this slide. In relative contraindications, it's like freezing behavior, for example, we can say, or vasovagal syncope. Here, I think. Yeah. So you can use, there is no study that you cannot use totally in hypersomnia, diarrhea or hypotonicity, but you must be cautious. You can start with lower durations. For example, we recommend starting with 15 minutes a day duration for the one session. Okay, 1 week later you can double the sessions. 15-minute sessions you can double. So totally 30 minutes a day. But if there is hypersomnia, diarrhea or hypotonicity, you can start with 5 minutes stimulation, and 1 week later you can increase it to 10 minutes, and 1 week later 15 minutes you can increase it. So seeing the effects of the stimulation, you can decide that, yeah, this is not suitable for that patient, we shouldn't do any more the stimulation, or we can continue with gradual elevations in the duration.
so
You
and,
can-
and is it the same with like the chronic fatigue syndrome
Yeah.
or something? It's the same
Yeah.
procedure?
Yeah, according to patient, you can change the parameters. It is suitable. But in customization, we will talk again. There is no totally contraindicated disorder for vagus nerve stimulation. No, there is no. But if there's an hearing implant in the ear, you cannot use the stimulation on that side. If 2 implants, then you cannot use the auricular vagus nerve stimulation. For the heart rhythm implants, for example, it can be used, but the permission from the doctor must be taken. If you want to apply, there's a battery inside the patient for heart rhythm problem, for example. So you should get the permission from the cardiologist or cardiac surgeon that implant that device. For the ear implants, hearing implants, you cannot do because it will disturb the electricity inside the implant. So it's forbidden. These are the only the 100% contraindication is the hearing implant in the ear. If it is two-sided, no. But if one-sided, on the other side, you can do it. Even the cardiac batteries, no total contraindication, relative contraindication, but you must take the permission from the doctor. So in all of these conditions, you can do, but start with lower durations. So if there is no more question, we can skip to other presentation, or we can give a break if you want.
Have you seen any effects on heart arrhythmias?
Heart?
Yeah, arrhythmias.
Heart arrhythmias, we haven't seen all the studies related to the vagus nerve stimulation says that it is beneficial for heart rhythm problems, because heart rhythm gets worse if the sympathetic activity is high. Arrhythmic problems. So they also give anti-adrenergic or anti-symptomatic drugs. So they want to decrease sympathetic activity. So it helps for the arrhythmia. Vagus nerve stimulation is helpful for the arrhythmia problems. For cardiac insufficiency, it is used. For the heart rhythm problems, it is also used. According to the studies, no harmful effects. So give a break or continue?
Let's have like 5-10 minutes.
5-10.
Get something to drink and go to.
10 minutes
10
break.
minutes.
10 minutes break. Okay. It's Turkish. Increase the weight. The weight of the luggage.
Google Translate.
Yeah.